Good morning, everyone. Welcome. Thank you for being here for this information session for business around the vaccination verification. My name is Su-Ling Ching, and it is my honor to be the President and CEO of the Ottawa Board of Trade. As the voice for business in Ottawa and a key advocate for economic growth, it is our mission to create a thriving business community. And this last year has really had us focused to that end on influencing the programs and the policies at every level of government and working closely with our local stakeholders to support our business community as we deal with the countermeasures of the pandemic and provide a strong foundation for our economic recovery and rebound. With the announcements, the recent announcements with the provincial government around vaccine verification, we did hear from businesses that there were a lot of questions, and we had questions specifically around today that we're going to answer around the enforcement. If I could say that the purpose of today's meeting is to share information and to try and ascertain what additional questions that we have that we can work together to support our business community on. That's what we're here to discuss today. I will go so far as saying what we're not here to discuss are the merits of the program that has been provincially mandated. I want to say thank you to Acobia, to the City of Ottawa, and to Ottawa Public Health, not just for quickly putting together today's information session, but for their support and collaboration over these last several months working together. And we really want to acknowledge that those partnerships, along with the resilience of the business community, has been nothing short of inspirational. And we feel as though this will provide a strong path for us moving forward as well. I will say our agenda today is we're going to hear from Acobia and from OPH, and then turn most of the time over to Jennifer and Kayla from the city and bylaw, followed by a Q&A session, which I believe will all be available for. And so at this time, I would like to welcome to the virtual stage Michelle Grew, who's the Executive Director of the Ottawa Coalition of Business Improvement Areas. Michelle?
Unmute. Thank you, Su-Ling, for your leadership, and thank you, Ottawa Board of Trade, for organizing this session in a very short time. Ottawa Bylaw and Ottawa Public Health received the regulations from the province only days ago, and I am thankful to the teams for putting this information together so quickly and presenting this today to our business community. Acobia heard from businesses in late August that many of you were concerned about a fourth wave resulting in further restrictions and lockdowns. We are seeing this happening now elsewhere. Many businesses support the implementation of a vaccine verification system. It is a means to keep staff and patrons safe and a means to support businesses staying open. In terms of recovery, Acobia has seen that COVID-19 restrictions, namely capacity, are one of the top 3 issues impacting businesses today. Acobia wants to assure our business community that with the increase of vaccinations and the use of this system we are learning about today, we will advocate strongly for a safe loosening of provincial restrictions. We are on the road of economic recovery and we cannot fall behind. Thank you to the many businesses who are here today to move us all forward. I'll hand it back over to our host, Su-Ling. Thank you so much, Su-Ling.
Thank you, Michelle. We appreciate all the work that you've done and your leadership through this time as well. Now I'm going to welcome Dr. Sarah Erdman from OPH and to give us a short presentation.
Thank you, Su-Ling. Thank you for the opportunity to join the conversation today. Thank you to Michelle and Acobia, all our BIAs, as well as you, Su-Ling and Lynn from the Board of Trade, and anyone who's watching and joining us today. We know that the COVID space has continued to evolve at an incredibly fast pace and that the business sector has continued to adapt to meet changing requirements. Thank you so much for all you've done to protect our community. OPH is here to support you as you implement the provincial requirements. I would be remiss not to note that the Ottawa community has continued to do amazing work in the vaccination space to protect themselves and contribute to community immunity. To date, 87% of those eligible have now received their first dose and 81% their second dose. This information is all available on our public COVID-19 vaccination dashboard. Switching gears to the topic of today's session, and on the heels of the announcement from our provincial government regarding vaccine verification requirements, OPH is ready and able to support people to get vaccinated. My colleagues Jen and Kayla from Bylaw and Regulatory Services will be speaking to the particulars of the vaccine verification system, as well as the regulations. Vaccine information, though, including where people can be vaccinated, is readily available on our website. We also have a host of FAQs about vaccines. I wanted to mention that drop-in vaccinations are available for those eligible for first, second, or third doses at any community clinic, pop-up clinic, or neighborhood vaccination hub in Ottawa. Various other locations offer the vaccine in Ottawa, such as select pharmacies. You can also make appointments through the provincial booking system if that option is preferred. Before I turn it over to Jen and Kayla, I wanted to highlight the availability of mobile vaccination clinics, where workplaces, community organizations, places of worship, and other groups can request a mobile vaccination team to administer vaccines on site at your location. Based on your group's needs, OPH will coordinate the planning and can set up a mobile team, assist in the promotion of your mobile vaccine clinic, and can even help answer questions about the COVID-19 vaccines. Services can be provided in a variety of languages. To request a mobile vaccination clinic, please complete the mobile vaccine clinic request form on our website or call us for assistance. The province's requirement to require proof of vaccination in certain settings is another step that will reduce the risk of transmission in our community. The decision as to which businesses and sectors were included in the requirements was made by the province. I would also note that other public health measures and workplace safety measures will still apply after vaccination, including provisions for masking and screening. I'd also like to highlight the definition of what fully vaccinated means. It means that it's been 14 days at least since you've received the full series of a COVID-19 vaccine authorized by Health Canada. So that would include 2 doses of Moderna, Pfizer, or AstraZeneca, or a combination thereof. 1 or 2 doses of a COVID-19 vaccine not authorized by Health Canada, followed by 1 dose of an mRNA vaccine, such as Pfizer or Moderna, authorized by Health Canada, or 3 doses of a COVID-19 vaccine not authorized by Health Canada. When it comes to businesses and workplaces, OPH strongly recommends that all Ottawa employers implement workplace vaccination policies for their staff to reduce the risk of COVID-19 transmission. To support this recommendation, we have released guidance available on our website and in our COVID-19 vaccine toolkit for employers to assist employers in the development and implementation of their workplace vaccination policies as part of their COVID-19 safety planning. Supporting employees to get fully vaccinated is the best way to help them from the risks of COVID-19, prevent outbreaks, and build confidence in the workplace as we face a more transmissible Delta-fueled resurgence in our community. We also recognize the significant toll the pandemic has had on the business community. We've also heard that many residents are looking to speak to someone but don't know how. I wanted to reiterate that there are mental health supports available for those in need. Please reach out if help is needed. There are some resources on our website, including mental health resources specifically for workplaces and employers. Thank you once again for all you're doing to protect our communities.
Thank you, Sarah. And Sarah, am I correct in that the province has also launched a helpline for anyone who has questions specifically around the vaccine?
Yes, that's correct, and I can share that. If anyone has questions, they can get in touch with a personalized person from the province who can answer their questions and help direct them as to where to book an appointment if they choose.
Okay, fantastic. Thank you so much. So at this time, we'll turn the podium over to Jennifer and Kayla from Bylaw and Regulations and Enforcement.
Thank you, Sue Ling. Hello, everyone. Thanks for having us today. My name is Kayla Woods, and I'm the Issues Management Specialist with Bylaw and Regulatory Services. To echo Dr. Erdman's comments, we appreciate the business community's ability to adapt to constantly changing regulations. Thank you to everyone in attendance today for the chance to speak. As we are all aware, beginning September 22nd, the province of Ontario will require patrons to be fully vaccinated and provide proof of their vaccination status and proof of ID to enter certain businesses and organizations. The focus is on locations that the province is deeming higher risk indoor settings. Recognizing the diverse range of businesses that we have on the call today, I thought I would take a couple of minutes to list the settings where the province has determined that proof of vaccination will be required. To enter a business or organization with limited exemptions, the patron must provide proof of being fully vaccinated and proof of ID at entry. Businesses will have to review and confirm this proof. So this applies to the indoor areas of restaurants, bars, and other food or drink establishments where dance facilities are not provided, but not with respect to takeout and delivery service. The indoor and outdoor areas of food or drink establishments where dance facilities are provided, including nightclubs, resto clubs, and other similar establishments, but again, not with respect to takeout and delivery service. The indoor areas of meeting and event spaces, including conference centers or convention centers. The indoor areas of facilities used for sports and recreational fitness activities, including water parks and personal physical fitness trainers, including the indoor areas of facilities where spectators watch events. The indoor areas of casinos, bingo halls, and other gaming establishments. The indoor areas of concert venues, theaters, and cinemas. The indoor areas of bathhouses, sex clubs, and strip clubs. The indoor areas of horse racing tracks, car racing tracks, and other similar venues. And finally, the indoor areas of places where commercial film and television production takes place, where there's a studio audience. So it's important to note that the proof of vaccination will not be required to access medical care, food from grocery stores, and basic medical supplies. The regulations also list the exemptions, which include patrons entering the indoor area solely to use a washroom, to pay for or pick up an order, or to access an outdoor area that's only accessible through an indoor route, or to purchase admission or make a retail purchase. Another exemption is for individuals under a certain age, such as children under 12 or patrons under 18 who are entering the indoor premises of a facility used for sports and recreational fitness activities solely for the purpose of actively participating in an organized sport. The exemptions will also apply to wedding services or ceremonies if not attending the social gathering that is held in a meeting or event space. It won't apply to social gatherings associated with a funeral service that is being held in a business licensed under the Funeral, Burial, or Cremation Services Act. And finally, the exemptions apply to patrons with written documentation completed and supplied by a physician or registered nurse that sets out a documented medical reason for not being fully vaccinated in accordance with the ministry's guidance and the effective time period for that medical reason. Patrons must show ID as well as the written documentation for this exemption. So in order for a business to verify proof of vaccination, they must match the name and birth date of the patron listed on the vaccination receipt with the information provided on their ID. ID can include a driver's license, birth certificate, citizenship card, health card, passport, status card, or Indigenous membership card, or a permanent resident card. Photo ID is not required. The name of the holder plus the birth date must match in order to be sufficient. If the name and date of birth on the ID and vaccine proof do not match, entry would not be permitted under the regulations for the specified businesses. Businesses are also required to verify that the vaccine receipt is either an Ontario receipt as downloaded and printed from the ontario.ca webpage, a receipt signed by an Indigenous health provider, or a receipt from another jurisdiction. The business is required to verify that the receipt shows the holder is fully vaccinated and to verify the date that the holder got their final shot in their vaccine series was 14 days prior to the date of the person seeking entrance to the business or organization. It's important to note that a business or organization is not to retain any of the information provided by the patron with respect to the proof of vaccine requirement. The specified businesses and organizations are responsible for ensuring they meet the requirements regarding requiring patrons to provide proof of identification and proof of being fully vaccinated against COVID-19 or the entitlement to an exemption, as outlined in Ontario Regulation 364/20. Patrons are required to ensure that any information provided to the business or organization to satisfy this requirement, including their proof of vaccination or their entitlement to an exception, as well as their proof of identification, is complete and accurate. Non-compliance of the regulations can result in charges under the Reopening Ontario Act. However, as always, bylaw and regulatory services will take a graduated enforcement approach with an emphasis on education and promotion first. In cases of violence, threats, or harassment, these matters are dealt with under the Criminal Code of Canada, and the police should be contacted in these situations. This would also apply for trespassing issues as well, such as in instances where someone is refusing to leave. Finally, I thought I would provide some key dates to remember. So as we know, September 22nd is when the proof of vaccination requirements take effect. And effective October 22nd, the Enhanced Vaccine Certificate and Verification app for businesses will become available. As of this date, patrons will be able to provide a paper or digital copy of their enhanced vaccine certificates with the unique QR code to confirm proof of vaccination. However, older versions of the receipt will still be acceptable. The Ministry of Health's proof of vaccination guidance for businesses and organizations under the Reopening Ontario Act document will be updated to reflect the new processes. Thank you again for your time this morning.
Thank you, Kayla. So Lynn, I think at this point, I turn it over to you for the moderated Q&A.
Absolutely. So the first question this morning comes from Coleman Swartz, and they just wanted clarification for the rollout date of the new app.
Okay, so Kayla, are you going to be able to stay on for answering questions? Yeah, you're on mute, dear. Yeah. Mm-hmm.
I think I would have got this down by now. Absolutely. So it's anticipated this will be rolled out by the province, but the new app is anticipated for October 22nd. And as mentioned, the Ministry of Health's guidance document would be updated to reflect those details.
Mm-hmm. Michelle and Sarah, maybe I'll have you come off mute as well in case any of the questions are for you. And Coleman, I'll just emphasize for you too that through the Ontario Chamber, we are advocating for the government to be very aggressive on meeting that deadline. So, Lynn?
We had a question emailed in. Sean Carrier, if you're still here, could you please unmute and put your question to the panel?
Hello.
Hi,
Sean.
Hi, I'm in the personal service setting industry, and I was quite surprised to find out that the passport or the implementation of checking the vaccines doesn't apply to us. I don't know if it's an oversight, but some of us are in contact with people like extremely closely. We're touching them. And since the latest reopening, we're actually allowed to do services under the mask. So be it, you know, anywhere from beard trimming to facials to tattooing and piercing or whatever the industry is, if it applies to the face, we're allowed to do it. Yet we don't have the luxury of telling the customers essentially, you know, we need this passport because it's not mandated for our industry. So we just basically, if we get difficult people, we end up arguing with them. I was just curious what the logic was from OPH or higher to not include us in that in terms of safety, because we'd like to implement it, but I feel like we don't have the backing basically from the city or the province on this because it doesn't involve us. I mean, some of us sit with customers sometimes anywhere from half an hour to 2-3 hours right in their face. So for the safety of basically our other staff in particular, I have immunocompromised staff. It puts us in a position where competitors are doing this, whether they have the same concerns of mine or not, and we have no choice. Otherwise, you know, if we don't offer these services, they're all going to the people that are. So it puts us in a very awkward position. Essentially, I'm just wondering if it would be reconsidered and applied to our industry.
Sarah, can you speak to that?
Yeah, absolutely. Thank you for your concerns, Sean. And I think that we at OPH share your concerns. The province dictated